All right, welcome everybody to today's episode of How Bad Is It? Here today we have with us Dr. Deepak Vadi, who is the chief of our emergency department here at St. Joseph Hospital. And we also have Dr. Jim Martin, who is the medical director of Milford Urgent Care in Milford, New Hampshire. So thank you, gentlemen, for being with us. We'll be asking both of these doctors a few questions about emergency care versus urgent care and which one you should go to when you have an injury or a sickness or an illness or a sting or any of those sorts of things. So we'll be asking them questions and the doctors will chime in when they think they know the correct answer. All right, so we'll start off with some softball questions. First question is, a patient has chest pain, urgent care or emergency care? Dr. Vadi.
That would be most likely emergency care. There's a lot of different reasons for chest pain, and certainly an urgent care could direct you to the emergency department. But there are many things that an urgent care would be limited in doing, and so the safest thing if you're having chest pain is to go to the nearest emergency department.
Great answer. Thank you, Dr. Vadi. All right, next question. Broken bone, urgent care or emergency care? Dr. Martin.
Kind of depends. How bad is it and what bone's involved? And whether it's sticking out or what we call an open fracture. So it really kind of depends. But if it's seemingly a minor fracture, like of a finger, forearm, ankle, that type of thing, urgent care is certainly appropriate for that. But if it's a major bone like your thigh, your hip, maybe even your upper arm, then that's more appropriate for the emergency department. If there's any wounds over the area of the break, that's definitely something that should go to the emergency department. But urgent care is definitely capable of handling minor fractures.
I think it's almost a maybe broken versus definitely broken question. So if you have pain and swelling, but everything's pretty much aligned and you can move your fingers, maybe urgent care. But if there's a bone sticking out and there's bleeding, can't move your fingers, you can't feel something, I think that would be a reason to go to the emergency room. Is that reasonable?
I think that's very appropriate.
Great, thank you. It's a close game right now, folks. We appear to be 1-1. Next question. Head injury or a suspected concussion, urgent care or emergency care?
Ooh.
Dr. Martin.
That's another one of those it depends questions. So minor head injury, no loss of consciousness, there's no associated vomiting, there's no signs of any neurologic injury like severe confusion, or what we call perseveration, where the person's kind of asking questions over and over again. They have weakness on one side of their face or body, something serious like that. That definitely involves going to the emergency department and probably calling 911. Somebody who's had a mild bump on the head with no loss of consciousness, maybe they're a little nauseous, they get a headache, that type of thing, it certainly could be appropriate for the urgent care setting where we can do our screening evaluation and decide whether or not they need a CT scan or further evaluation in the emergency department.
Perfect, thank you. Next up, we have flu-like symptoms, emergency care or urgent care? Dr. Vadi.
I would say that many flu cases could be seen in the urgent care if you're able to walk and you're not confused. You may or may not have a fever necessarily, but you're not feeling lightheaded as though you're going to pass out. I think going to an urgent care is very reasonable. Knowing if you have the flu or not is very helpful to figure out how much care needs to be rendered, how much rest you need to take. But if you can't get up, if you need assistance to get into the car, you're thinking about calling 911, the person's confused, those would be reasons to go to the emergency room instead.
Perfect. All right, we have a few more questions here. Let's see, urgent care or emergency care, bleeding that doesn't stop after 5 minutes?
Well, that's kind of an easy one.
Oh, Dr. Martin.
That's definitely the emergency department. Controlling bleeding is a potentially very serious thing, and if you can't control it easily, or even if it took a long time to be controlled, the source of that bleeding, the cause for that bleeding needs to be determined, and that would be through the emergency department, where appropriate blood work could be performed that was needed, which is not done in the urgent care setting. So I would say that type of patient belongs in the emergency department.
That's a great answer, Dr. Martin. However, we have to deduct a point from your total because you did not raise your hand. However, great answer, though. We appreciate it. Next up, a seizure. Emergency care or urgent care? Dr. Vadi.
A seizure would go to the emergency room every time. Even if you have a known seizure disorder, there are complicating factors that need to be ruled in or out. That could potentially make it life-threatening. So whether it's a first-time seizure or a recurrent seizure, it absolutely needs to go to the emergency room right away.
Great, thank you. All right. This next section of our show, we have a couple comparisons that we want to make, and which one requires urgent care and which one requires emergency care. So the first one, and I'll give this to Dr. Martin, shark bite versus tick bite. Go.
Ooh, I'll take the tick bite. Shark bite, thank God we don't have those around here. If we did, then maybe global warming's really progressed and we have big problems with our ocean fine now. But yeah, tick bites, that is something that we handle daily in the urgent care setting. It's something that can easily be handled through the urgent care as opposed to the emergency department, assessing the patient to see how bad the tick bite may be or whether they're having symptoms associated with it, and then it's usually appropriate therapy after that. And sometimes people can't get the tick off and we take the tick off for them. So that's definitely our domain. However, if someone's had a tick bite and they're really feeling sick, they have fevers and they ache all over and they've got bad headaches and other symptoms that suggest a more serious potential infection from a tick bite, then that would be the one instance where a tick bite should go to the emergency department. Because then they're going to need blood testing done that we don't do in the urgent care setting.
I would agree. There's more than Lyme disease that are tick-borne illnesses that we can test for, and it would be important to know.
All right. Next question is for Dr. Vadi. Dr. Vadi, struck by a car versus struck by lightning. Emergency care or urgent care?
Okay, so I would say both of those should go to the emergency room. The struck by a car is almost always a pretty serious event. Especially we find that the elderly population seems to sometimes not hear a car coming in a parking lot, so we see a lot of people struck by a car in that regard, and they may not really present with the same pain symptoms that somebody younger would. So that's definitely should, if you've been hit by a car, you should definitely go to the emergency room, even if you feel generally okay. In regards to being struck by lightning, that hopefully you would be around still to make it to the emergency room. Definitely, this is thunderstorm season for us. We've had a lot of rain lately, so I think it's important to remember the precautions. So being in a car is relatively a safe place to be in a lightning storm. Don't be outside or near trees, near large bodies of water. Don't be standing in puddles. Those would be ways to become electrocuted or potentially struck by lightning. But a car is a safe place to be. And if you are indoors, trying to stay away from windows is also safe to do.
All right. We have one more question for each of you. Dr. Martin, stung by a wasp or stung by a swarm of wasps?
Well, I'd go with one wasp for the urgent care and a swarm of wasps for the emergency department. And there's a little bit of, it depends in that question as well, because you can be stung by one wasp and have a severe anaphylactic reaction. And you can potentially be stung by multiple wasps and not have a severe reaction. So it does kind of depend on how your body responds to that actual sting and the venom that's given to you from that sting. So if you have a simple sting and you have local pain and some mild symptoms associated with that sting, that's certainly appropriate for the urgent care. But if you have one sting or multiple stings and you're having any kind of trouble breathing, your lips or your tongue swell up, you feel like your throat is closing up on you, you're covered head to toe in a rash, hives right away, vomiting, that type of thing, that's a 911 call. And you definitely need to go to the emergency department for that. But urgent care is definitely a good place to go for a minor wasp sting or bee sting.
Perfect. Well, that is all we have for our show today. Thank you both to Dr. Vadi and Dr. Martin for joining us.